Alright, so next thing I'm gonna do is I'm gonna do the posterior iliofemoral ligament for cat 3 blocking. First thing I'm gonna do is I'm gonna check the restriction on by internally rotating the foot. I can see the restriction on the right side. On the right side, what I'm gonna do is I'm gonna go an inch posterior and superior from the trochanter. I'm gonna have a double thumb contact, and then I'm just gonna impulse towards the opposite obturator foramen. And once I have done, I will recheck, and it should be even. Next thing I'm gonna do is lumbar derotation. So what I'm gonna have the patient do is I have her prone. I'm gonna using the Lovett system. I'm gonna palpate for cervical TVP tenderness, and let's say it's C2. So CT correlates with L4. So she has a right tenderness on right side TVP tenderness on C2. I'm gonna go to L4, find it. What I'm gonna do is I'm gonna bend the leg, and then as she inhales, I'm gonna apply lateral medial pressure on the spinous process of L4, and at the same time, I'm gonna bend her neck, bend her foot or heel touching the glute as she inhales, and hold it for 5 seconds. I'm gonna release, and I'll do that around 3 times. The next thing I'm gonna do is lumbar inferiority. Um, so it's almost the same thing, except instead of cervical TVPs, I'm checking for cervical spinous process tenderness. And let's say she has a C2 tenderness on the C2 spinous on the right side. So I'm gonna be on her right side. I'm gonna bend the leg again. But instead of pushing lateral medial, I'm gonna push inferior superior as she inhales on L4. And as she does, and as I push and apply pressure, um, I'm gonna push on the foot so the heel goes towards the glutes, and I'm gonna hold it for 5 seconds, release on exhalation, and then repeat around 3 times. The next thing I'm gonna do is acetabular goading. So I'm just gonna have her check for tenderness on which side is more tender, or it could be both sides. Have her leg, have her knee bent. I'm gonna internally rotate the leg, feel for nodules, and then I'm gonna goad it, and I'm gonna external rotate it, and then do the same thing. All right, and then that's it for that. The next one's gonna be orthopedic blocking. Orthopedic blocking is just the side of spinous rotation. Say she has a spinous to the right. I'm just gonna pull the block for that side. So, and that's gonna lower the pelvis, which will also derotate the spinous towards the opposite side. Um, and that's it for that. And then the last one is going to be, I'm going to put the block back. The last thing is going to be sciatic traction. So she has sciatica going down the right leg. What I'm going to do is I'm going to have her traction table. I'm going to hold the leg just above the ankle. I'm going to traction back down for 5 seconds. Release. Do it around 3 more times. If the pain is not getting better for the patient, you can do an assist where I have the patient have a CA or somebody else in the office to traction the leg like I just did, and I'm gonna go to the level, the affected level. Let's say we're doing L4, and from there I would push I to S as the patient traction, as my CA traction down, and that's all that for